Everyone, in this video I hope to let everyone know on actually what is thalassemia condition, or hope to let you know a little more. So thalassemia, do you have this blood disorder? What is thalassemia? Thalassemia is an inherited blood disorder which is caused by an abnormal genes. A person with thalassemia is unable to produce normal hemoglobins in the blood. Hemoglobins, or Hb, carries oxygen in the blood from the lungs to all parts of the body. When the body is unable to produce normal hemoglobins, the resulting low hemoglobin levels give rise to anemia. Thalassemia is passed on from parents to child and can affect both male and females. In Singapore, typically about 3% of the population are carriers of thalassemia genes. So what are the types of thalassemia? There are two types of thalassemia. First is the Thalassemia Minor, known as the Thalassemia Type 2. Secondly, the Thalassemia Major, which is the most severe form of thalassemia, which is the condition I have, and the minor is the less severe form of thalassemia. A person who has inherited one thalassemia genes is said to have Thalassemia Minor or Thalassemia Type. He or she is healthy and leads a normal life. Most people with Thalassemia Minor do not know what they have it, how they have it. However, the affected person can pass on the abnormal genes to their children. Thalassemia Major is a severe form of anemia. In fact, it's the most severe form of anemia. The affected person has inherited two thalassemia genes, one from each parent, meaning both the mom and the dad has these affected thalassemia genes. He or she may look normal at birth, but within 1 or 2 years of life will suffer from severe anemia, which leads to poor growth and development, as well as a shorter lifespan or life expectancy. So the child giving birth by look normal before the age of 1 or 2, but before, in between, or after the age of 1 or 2, the symptoms of the thalassemia tend to occur, like the poor appetite, weak, pale, inactive. All the symptoms tend to occur. The affected person will need a lifetime regular monthly blood transfusion to sustain life. At present, a bone marrow transplant, the BMT, is the only hope of a possible cure for Thalassemia Major. So how is thalassemia inherited? Once, if only one parent has Thalassemia Minor, the following scenario can occur. So 50% chance of having a child with thalassemia. So one parent have Thalassemia Minor, the other child has 50%, 50-50 can get Thalassemia Minor too, and 50% chance of a normal child, meaning not even a Thalassemia Minor. So that's why I call it 50-50. None of the couple children will get Thalassemia Major, meaning it is impossible for the child to get Thalassemia Major if only one parent are inherited from the Thalassemia Minor genes. 2. If both the parents have Thalassemia Minor, which is where you want to be aware of, the following can occur. 25% of having a child with Thalassemia Major. So 75% you won't get a Thalassemia Major, which definitely want to be avoided, and 50% chance of having a child with Thalassemia Minor. 25% chance of having a normal child. So the chance of getting a thalassemia major seems risky, and if not, you might end up in thalassemia minor too. So they definitely go for this screening. The chances are the same with each pregnancy, no matter how many children the couple may have. So even when your first child has thalassemia major, if you intend to give birth to another child in the years to come, thinking that you won't get the thalassemia major patient, your child like thalassemia major again, you are wrong. It has the same equal chance of getting the amount of child inhabited with thalassemia. So who should go for thalassemia screening? Since thalassemia can pass on from one generation to another, you and your partner should go for thalassemia screening if you are planning to get married or starting a family. Thalassemia screening involves a simple blood test and is available at all polyclinics. So it's a simple blood test. I think it's like finger prick or some needle used to withdraw blood from your vein. So it's like quite a simple procedure. So definitely you have to go for it to avoid all the trouble of giving birth to a thalassemia major kids. So what should I do if I have thalassemia minor? If you or your partner has thalassemia minor, both of you should see a doctor for genetic counseling before you plan to get married or have a child. The doctor will explain the risk and discuss the choice you have. He may refer you to the National Thalassemia Registry for further counseling. The National Thalassemia Registry provides genetic counseling for people with thalassemia and screening for their families. The staff at the registry will be able to answer your questions about this blood disorder. So if you are unsure about what are the symptoms or anything you have a problem understanding with, do check out with them. They are the National Thalassemia Registry, Level 8 of Children Tower at the KK Women and Children Hospital, the KKH, 100 Bukit Timah Road, Singapore 229899. Their phone and fax provided. So they are located, the nearest MRT is Little India. What if I already have pregnant? So you did not go for the screening and now you are pregnant and you are afraid of having a kids with thalassemia major. So what should you do? If you have already pregnant and both you and your husband have thalassemia minor, then you have a 25% chance of having a thalassemia major kid. So you're worried. You should go for a prenatal diagnosis test to find out whether your unborn baby has thalassemia major. Prenatal diagnosis can be done by loose sampling or by this fetal blood sampling. Both tests are conducted under ultrasound guidance. Chronic villus sampling involves obtaining a small amount of fetal blood from the umbilical cord for testing. This procedure is done at about 12 to 19 weeks of pregnancy. So it's like 3 to 5 months time of your pregnancy. So that's my website. This is top here is my official website. I put it wrongly, and below is my main website. So be sure to check it out. And we have come to the end of the video. Just giving you a PowerPoint presentation on actually what is thalassemia, letting everyone know a little more about what is thalassemia. Hope you enjoyed it. Thanks for watching. I'll see you guys later. Bye for now.